First of all, I just want to say thank you so much for being here. But more importantly, how beautiful the French language is, and how much I really desperately need to start freshening up on my French, because you're making me very envious of losing the language, which is shame on me because I should really get better at it. Thanks everybody for being here today on a 12 o'clock on a Friday afternoon. I'm sure all of you are very busy, and the last thing you want to hear about is evidence, but we'll hopefully make it exciting for you to be here and worth your time. My name is Firas Khalid. I'm a CHR Health System Impact Fellow at the Canadian Red Cross and the Ottawa Hospital Research Institute with Dr. Jeremy Gerbshaw, who is a knowledge translation expert. I'm excited to be here today to talk about work that we've been doing for the past 2 years on evidence summaries, the synthesis of evidence summaries, and the use and implementation of it to inform real policy and practice, both at the Canadian Red Cross, but overall health system partners and multilateral organizations across the world. I can't start my presentation without thanking the team members that are behind this work at the Canadian Red Cross. And I want to start by talking to you a little bit about what evidence-informed decision-making means. So for over 7-8 years now, I've devoted my time and effort to figure out how does evidence-informed decision-making and practice plays out in health and humanitarian emergencies. And what we've come to realize is that evidence-informed decision-making is not simply just a process of providing more evidence. Actually, on the contrary, what we're learning, especially after COVID-19 pandemic, is that there is ample amount of evidence out there. Evidence-informed practice is really about finding ways to support the use of the existing evidence, both in decision-making, in practice, and in policy. And the need for evidence support in health and humanitarian emergency is even more important because of the time and practical constraints that decision makers who operate in these settings face. Think about an earthquake, a fire, a COVID-19 pandemic, an infectious disease. The time is of the essence. Decision makers are put under a lot of pressure to figure out how to do the best interventions in place to ensure the effectiveness and efficiency of interventions. And therefore, evidence-informed practice becomes especially important in those settings. I spent much of my work really looking at health and humanitarian emergencies evidence needs. I spoke to many decision makers who work at the top organizations around the world who focus on addressing health and humanitarian emergencies. And I wanted to figure out, what is your preference of how you would like to get evidence? What are some of the formats and the challenges and the facilitators and barriers that enable us to make sure that you receive evidence in real time? And based on that work, we developed an evidence summary template that I'm hoping will really change the way evidence-based practice and health and humanitarian emergencies is. So the gap that we're trying to address in our research was looking into how there's very little that is actually known about the use of evidence summaries. We've seen them in use in clinical settings, but we've hardly ever seen them used to inform real-time decision-making in crises. The easiest way for me to make you think about this is think about the last time you had to buy a car or a house or something really expensive. Where did you go to find that evidence? How difficult was it for you to be able to figure out what is the most accurate, high quality evidence to inform your decision? You're about to make a big purchase. You're trying to decipher through so much information out there, but you really want it in a format that helps you make that decision in real time to make that purchase. That's the same idea that we came around with this work. And so our study was a mixed method study that really looked to explore what are decision makers who work on health and humanitarian emergencies, views of evidence summaries, and how can we come forward with a template that we can standardize and across organizations and stakeholders so that they can really help them inform decision-making in real time. It was an explanatory sequential mixed method studies. And again, we've interviewed decision makers from all kinds of fields. So those are directors, senior directors, field managers, practitioners, healthcare providers, and researchers and analysts who respond to the needs of decision makers in real time. We gave them a survey and we conducted semi-structured interviews with them, 26 of them in total, and we really were able to come forward with exceptional results that I think will change the way we think about evidence-informed practice in this field. So here's a question for all of you joining us today. What do you think? And usually if I do this in real life, I'll give you chocolates. So if you ever see me at an airport or a conference, or hopefully in your own setting, please ask for your treat. I'll definitely have it in my bag. What do you think is the top preferred feature within an evidence summary that was cited by decision makers? You can jump in the chat, or you feel free to unmute yourself. Do you think it was a link that directs you to the full text source? Do you think that decision makers said that their preferred feature is a concise summary of the evidence, which includes the benefits, harms, and costs and implementation considerations? Or do you think it was key messages in a bullet point format? Or is it about information about the methods of the summarized systematic review? Or do you think it was an assessment of the quality of the evidence? What was the top preferred feature? Yeah, so whoever said number 3 was absolutely correct. Decision makers really wanted actionable key messages in bullet point format. All the previous evidence that we saw was talking about, and all the other evidence summaries that were produced in the past, specifically for clinical settings, was really more focused on providing this detailed explanation of what the interventions are and how they should implement it. And what we found out from our research is that actually they don't want that. They find that too hard to decipher and understand and synthesize in real time. And they really wanted this more in a key actionable messages in a bullet point format. I'm just going to take a note of the person who said it first. Yep, I got her name. So in case you ever want that treat, I don't want to make a mistake in the way I pronounce your name, but I think it's Araceli. But if I'm wrong, I have your name just in case you ever see me. Or I'm happy to mail it to you if you send me your mailing address. Here's another question. I'm showing you my favorite chocolate candies. Which of the following answers correctly describes now the challenges that decision makers face when they try to find and use research evidence in crisis? So here we're really trying to get at the challenges. Is it the fact that they have insufficient time, an increased burden of responsibilities during crisis? Often when you're dealing with a crisis, you're dealing with multiple ones, or crises that have multiple nuances to them that you have to deal with in real time, which makes it very difficult. Is it about limited access to a reliable internet connection? Think about the settings that crises happen in. Often there is very unreliable internet connection. So it's very hard for those decision makers to go and seek that evidence. Is it about the burden of navigating multiple websites at the same time? Or is it the fact that there's a large volume of data that's not translated into user-friendly summaries, or a plethora of different websites on the same topic, and the fact that there is little information available on preparedness and response measure? Or is it all of the above? What do you think is the biggest challenge, or the most correctly describes the challenges that people face? I really appreciate your engagement. It's awesome. Usually I have to beg people to answer questions. This is awesome. Thank you. So yes, it actually is 7. So Claremont, I definitely owe you a prize. It is all of the above. We found out from our evidence that really it's all of the above, the challenges with people trying to find and use evidence. So what we decided to do was, okay, if we know this now, let's put forward a template for it. So we found out that in situations where there is time and resources are limited, evidence summaries actually take precedence in informing decision making over extensive systematic reviews. The reality is decision makers who work in crises do not have time to read systematic reviews and really want this evidence in short summaries with key actionable messages highlighted in a bullet point format or in an infographic, which we're seeing this in the next study that we're working on, is the effectiveness of infographics. And we saw that they really prefer curated information sources, so sources that come from in-technical house advisors or colleagues, and they really wanted summaries that demonstrate some form of critical appraisal of the evidence, so that they easily can trust the evidence that's being presented to them. We put forward the template. You can see the template here. It's currently in publication. About what that, and the hope of this template is to standardize the format of how evidence summaries are produced. And I just want to show you some of the recommendations that were put forward when writing the summaries, that they have to be clear, succinct, and action-oriented, that they really have to identify the target audience. Who is this evidence summary supposed to go for? It has to highlight the most up-to-date evidence on the fast emerging crises. And it really standardized the format of the evidence summary to make it easier for them to read it quickly in real time. and presenting the content of evidence summaries in alternative format. Things like audio podcasts and videos are really the key format of how decision makers want to receive that evidence, and actually emphasizing the role of organizational stewardship. This idea that higher level governance need to support the use of evidence summaries and create time in people's schedules to actually be able to request evidence summaries and to be able to use them to inform decision making. I want to give you an example. We've been implementing this at the Canadian Red Cross, and now we've had more than 28 requests that we were able to respond to in real time. This is just 2 examples that I want to showcase here today. We've had a request from CRC facility managers and people services about how to improve ventilation in the built environment to reduce airborne transmission of infectious diseases. And as you can see from example number 1, we were able to put together an infographic for them, key recommendations of how to address the question, and implementation considerations, which are trying to get at, if you were to take our recommendations, what else should you keep in mind? What are the costs? What are some of the physical structures that are in place that you might want to think about it based on the best available evidence? So what does all of this mean? It means that organizations that are tasked with synthesizing evidence summaries can really use our practical recommendations to improve the structure of evidence summaries templates and websites, and that our template can really streamline the process of not just responding to decision makers' needs, but also the way we produce evidence. And we believe that our training workshops that we're implementing now, because we're training researchers and practitioners in the use and the synthesis of evidence summary template, can really be important to ensure understanding and compliance with the evidence summary template. I want to thank you all for your time today. Please reach out to me. I want to hear if you're thinking about implementing evidence summaries, if you're interested in this format, if you're interested in an evidence summary template. We're happy to share these resources. The more we can share it, the better. Thanks, everybody. I'll stop sharing my screen.